So Dr. Shrikant, the stage is yours. All right, you can begin with your testimonial presentation.
Good evening all. Myself Dr. Shrikant. I am from Bandara in Maharashtra. By profession, I am a district epidemiologist and working in public health department. I have experience around 15 years in the public health. Now I come associated with WQ community since last 1 year. I also work on my health and I get benefited from the WQ community. That's why I also involved and voluntary working for the WQ community, and now happily helping many peoples also and some doctors also. Because which I get benefited from the WQ community, I also want to transfer the same benefit to the others, especially doctors who are like me, suffering from like lifestyle diseases, especially. Without wasting time, I'm also starting my presentation. Today, I am presenting case of hypothyroidism, and the case is also a doctor. Is my screen is visible to all?
Yes, it's visible.
Thank you. So today I am going to present a case on one medical professional, that is doctor. In this presentation, I covered 4 points. First of all, I covered with the profile of case. Second, what the case suffering from, or what are the health challenges she have, and what are the interventions by me or with the help of WQ community I had done, and the result, what is the result of after this intervention. These 4 components I will complete in this presentation. First, the profile of the case. She is a 33-year female, height is 5.3 and weight is around 73 kg, having 1 kid of 4 years, living in the joint family and living in Varora in Chandrapur district of Maharashtra. By occupation, she is a BMS and MD doctor practicing in hospitals. As doctors have a busy schedule, she have a schedule with since morning to evening, 6 a.m. to 6 p.m. And the hospital is away from almost 25 kilometers from his house. So the traveling time and other times she have to spend much time on her for job. So managing the household and occupation, she is suffering from hypothyroidism. She is suffering from the hypothyroidism as well as hypertension and hyperlipidemia. When I consulted, actually she is got referred by one of my client. She is the one of friend of my client, and I got the reference from her. She is suffering from hypothyroidism since 2010. Initially, when she diagnosed as a hypothyroidism, she started treatment with 25 mg thyroxine, and after every year, whenever she went for the for checkup, always her thyroid levels are increases, TSA especially, and doctors give them high doses of thyroxine. So in that way, since last 10 years, she now reaches up to the 125 mg thyroxine per day. But there is no relief. Whatever the symptoms of hypothyroidism she have already, tiredness, being sensitive to cold, weight gain, constipation, depression, muscle aches, weakness, and muscle cramps. So she already have all symptoms in spite of taking high dose of thyroxine. Another disease she have having with hypertension and hyperlipidemia. Since 1 year, she developed the hypertension and hyperlipidemia also. And stress factor is one of the important because of her family schedule plus job schedule and suffering from the thyroid conditions. After consultations with detailed history taken by from me, I advise her some tests, like for example, thyroid profile, total lipid profile, KFT, LFT, CBC, and HbA1c sugar. What are the findings? I have found that the TSH level is almost 15.78, HbA1c level is 5.81, most in pre-diabetic condition. Hemoglobin is 9.1 and triglycerides up to the 200. These are the findings in the laboratory test. After the consultation and daily schedule and their dietary patterns, I have designed the treatment plan for my client, and as per the guidance from the WQ community, I work on the 4 components of their lifestyle. First is the diet plan, second is the physical activity, third is the meditation, and fourth is the nutritional support. What I give in the diet plan, just a simple balanced diet, and whatever they have the dietary pattern correct that dietary pattern as per the balanced diet, which is all required for the healthy lifestyle. Physical activity, just starting with the normal walking, basic physical activity, some yoga. In the WQ community, we have the specialized yoga for the specialized diseases. So I have provide her thyroid therapeutic yoga and meditations, and give them nutritional support. So this type of intervention plan made for her. After the giving treatment, how the client will respond, that for that we have conduct the daily follow-up schedule. Initially, for first 10 to 15 days, as per the diet plan or as per the given exercise schedule, does the client following that, we have to maintain that daily follow-up schedule. And this is the online schedule. So I have monitor her breakfast, lunch, dinner, and activity also with the help of these tools, or with the help of Miss WhatsApp. They shared me the photos of their breakfast, lunch, and dinners, and whatever they have done the physical activity throughout the day, they share with at the end of the day, they share me the steps, or they completed in total one day. So this is the daily follow-up schedule. After the weekly follow-up schedule, after daily follow-up schedule, we have conduct the weekly follow-up schedule. After we measure the some measurements, body measurements, and weight. Every week we conduct the specialized session for follow-up, 10 to 15 minutes session with video consultation. How the client responding to our plan, and as per the result shows, before this client have like abdomen, waist, hip, thighs, arms, and neck measurements, and after this the improvement already shown. For example, abdomen initially it was 85 centimeter, then it's almost 74 centimeters. Waist is 99 centimeters, it's almost 86. So there is a every change in every parameters of body. Same way in the weight, initial the weight was 72.7 kg, and after 62, after 3 months of treatment, 62.4 kg. So these are the parameters monitored by the client herself on their at home. So they only share the photos, means whatever the improvement they are seeing in their own, they can share with us. That's why they are very, and especially they work for we have worked for the hypothyroidism. So initially at the date first investigation I conducted at the 24 November 2022. At that time her TSH was 15.78, and after 2 months I repeat the same test at the after 2 months in 27 January, after completion of 2 months. So that comes around 2.24. So that was very amazing result for the client and me also, because it shows very improvement with the same dose. Actually, initially I not decrease her doses as per the whatever she on going on her doses. So I keep that. After decreasing seeing this report, I decreased the in tapering fashion the doses up to the 100 mg, and now it's 75 mg. And day by day we are try to manage her doses, and target is our zero thyroxine level and normal hypothyroidism within, and the and now in March again after 1 month 2 months are tested, so now its TSH level is 1.19 with the 75 mg thyroxine tablet. So these are the results. She are very happy with this result, because uh, uh, the results are visible in physical conditions also, in terms of measurements, in terms of weight, and at the level of laboratory test, not only in the means physical parameters, also in the laboratory test. So this is the result after the 4 months of interventions. Her TSH are 15.78 to now comes it's around 1.19, and cholesterol back to healthy age, and weight is also reduced from the 73 to 63. These are the physical parameters. I'm very happy with that. But again, this just testimony of the photo I actually pick up. That is her status for her. She is participated in her girls annual day functions, where the kid and mom's fancy means fashion show is there and competition is there. In that actually she win the prize, and she is very for it. I just congratulate her on message. So she has replied me that that credit goes to you. This is very much, this feedback is lots for me, because I am not only create the health transformation, but it's her in life also transforms, like, and she is very happy with that. So this is very happy. I mean, I am very happy with this client results, and client is also very happy with this. So this is all due to the WQ community lifestyle that we are following, and the pattern we are following. Thank you. This is from my side.
Wow, Dr. Shrikant, that was simply amazing. And what a testimony. Perfect. And the presentation which you made was also perfect. I think you'll have to stop sharing so that, the screen is visible for everybody then. Right.
Yes.
Thank you.
Thank
So,
you.
Dr. Shrikant, you made me nostalgic. I felt as if, there is a case presentation which is going on. And, as during the time of exams, we used to present the testimony or present the case. So you were presenting a testimony in a similar format. And if I would have been an examiner, I would have given you 100 marks, all right, full 100 out of 100. Absolutely fantastic testimony.
Thank you very much for your appreciation.
Beautiful, because which client will not be happy after having such a result, and within a span of 3 months, I'm sure her thyroid is also on the way of reversal, and she will achieve that result as well. And these kind of testimonies, they actually are very encouraging. And somebody who has been struggling maybe with thyroid problem or overweight problem, this is an inspiration for them, and it actually helps them to take a decision so that they can also get started and they get a hope that yes, transformation is possible. Thank you very much, Dr. Shrikant, for that wonderful testimony. Let's move on to the next topic, and the next topic is about wellness lifestyle. And Dr. Ujjwala, who better than Dr. Ujjwala can speak about it? Okay, she is all herself a Ayurvedic